Hi everybody, welcome to my YouTube channel Dr. Srinivas Medical Concepts and my FB page Dr. Srinivas Concepts. This is Dr. Srinivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the books Focused Neurology and Exam Oriented Clinical Neurology. My email is sriklpm@gmail.com. We are continuing with the series of neuroimaging concepts. Today we are going to discuss the susceptibility weighted imaging known as SWI, neuroimaging concepts part 15, the susceptibility weighted imaging SWI. When the RBC gets disintegrated, it releases various products as the hemoglobin gets disintegrated. So first we have the oxyhemoglobin. So first initially we have the oxyhemoglobin, but with the passage of time it becomes deoxyhemoglobin. With the passage of time it becomes methemoglobin, and then finally hemosiderin. So hemosiderin indicates a chronic hemorrhage. So when there is hemorrhage and as the RBC gets disintegrated, the hemoglobin goes through the various stages with the passage of time. So all these various disintegrated products of RBCs, namely the oxyhemoglobin, deoxyhemoglobin, methemoglobin and hemosiderin, gives rise to various signal changes on T1 and T2 by which we can stage the cerebral hemorrhage, whether it is hyperacute, acute, subacute or chronic, depending upon the disintegrated RBC, that is the hemoglobin chemical substance, and the signal it produces on T1 and T2. So the disintegrated RBCs, the oxyhemoglobin, deoxyhemoglobin and methemoglobin and hemosiderin, indicates the time course of the disintegration of the RBCs. So first, when the RBC gets disintegrated, there is oxyhemoglobin, next there is deoxyhemoglobin, next there is methemoglobin, and then there is hemosiderin. So this will be acute, subacute, and then once it becomes hemosiderin, it will be a chronic stage. So we can easily recognize the various stages and the time course of the cerebral hemorrhage by the signal changes on T1 and T2. So this enabling one to approximate the age of hemorrhages and to follow the resolution. But another important sequence wherein we can appreciate the hemorrhage well is this sequence known as susceptibility weighted imaging SWI. The susceptibility weighted imaging or the gradient echo GRE. So the susceptibility weighted imaging or gradient echo is especially sensitive to blood and its breakdown products that appear hypointense. So the susceptibility weighted imaging or the gradient echo GRE is especially sensitive to blood and its breakdown products that appear hypointense. Especially this sequence is very much useful in elderly with hemorrhagic changes, which is most probably due to amyloid angiopathy. So in elderly hemorrhagic patients, usually it is because of amyloid angiopathy. So you can see the various hemorrhagic products in the cortex. If you see various hemorrhagic products in the cortex in elderly patients, we should always suspect amyloid angiopathy. Whereas hypertensive hemorrhage is well seen in four conditions, in four areas. One, the putamen, second the pons, third the thalamus, fourth the cerebellum. So they are basically seen in the brainstem and the basal ganglia, hypertensive hemorrhage. Whereas amyloid angiopathy is basically seen in the cerebral cortex, especially in elderly. So if we see this diagram, we'll be able to better understand it. So here you can see this is the flare, this is the T2 star. Here this is the susceptibility weighted imaging. So this is the condition cerebral amyloid angiopathy. So you can see all these hypointense signals, These represents the hemorrhagic products which are well seen on this sequence known as susceptibility weighted imaging. Kindly note that the hemorrhage is more present in the cerebral cortex. So if we see hemorrhage, that is a hypointense signal on the susceptibility weighted imaging in the cerebral cortex, especially in elderly, we suspect cerebral amyloid angiopathy. Whereas if it is hypertensive bleed, usually we see the signal changes in the putamen, pons, thalamus and the cerebellum. So you can see in the amyloid angiopathy, this area is relatively spared. So you can see this area, which is the classic site for hypertensive hemorrhage, is relatively spared in cerebral amyloid angiopathy. And in cerebral amyloid angiopathy, mostly the hemorrhage is seen in the cerebral cortices. So if we see cerebral hemorrhage in the cerebral cortices, especially in elderly subjects, we suspect cerebral amyloid angiopathy. So this sequence, the susceptibility weighted imaging sequence, is very useful to pick up hemorrhage, especially in conditions like cerebral amyloid angiopathy. So these are the important concepts of the susceptibility weighted imaging sequence. The other important concepts of clinical neurology, especially exam oriented clinical neurology, I put in a book called Exam Oriented Clinical Neurology. I am the author for this book, Dr. Srinivas. This book will be very useful for students appearing for clinical neurology exams. So if interested, this book could be purchased. The other important book I have written is the Focused Neurology book. I am the author, Dr. Srinivas. Most of the important concepts of neurology I put it in this book, Focused Neurology. This book will be very useful for students appearing for oral exams, Viva. And this book is available online from all leading booksellers including Amazon. So if interested, this book could be purchased online. So I hope you have enjoyed listening to these wonderful concepts of susceptibility weighted imaging. If you have enjoyed this, please like and share the link, but please subscribe to my YouTube channel, Dr. Srinivas Medical Concepts, which is India's leading neurology educational YouTube channel, and my FB page, Dr. Srinivas Concepts. Thank you. Bye.